My name is Alphonce Nsabi-Muhimbili, an emergency medicine physician specialist from Muhimbili National Hospital. So for the past 4 days, from the 24th of June to 27th of June, which is today, 2025, together with my fellow colleagues or participants from other sectors, we've been in a workshop here in Morogoro. The workshop is organized and coordinated by the Ministry of Health of Tanzania, especially the Emergency and Preparedness and Response Unit, in collaboration with the development partners, the World Health Organization. So through this workshop, we've been able to utilize a tool, abbreviated STAR, which is a strategic tool for assessing risk. And using this tool, we've been able to identify hazards which are capable of turning into disasters of health importance. And we've gone further using the tool or utilizing the tool and characterizing and factoring in such factors as geographical areas of possibilities of occurrences of disasters. We've factored in factors as frequencies of occurrence based on external factors such as the previous history of occurrence. We've gone further and looked at the likelihood of such disasters happening in our country in the next 12 months. It's been a very successful exercise, which has been like an evidence-based information for the national preparedness and response in terms of resilience and profiling these disasters, and as far as providing contingency plans and action plans that can be used to mitigate these disasters whenever they occur. So this is a very good exercise and it's been very successful. For me as a health professional, I have been able to air and add my contribution, given the fact that the health disasters do not originate only from the health sector. Hence the involvement of other sectors such as transportation, sports and entertainment, and so forth and so forth. So we'd like to thank the government of Tanzania through the Ministry of Health, especially the Emergency Preparedness and Response Unit, together with the collaboration, in collaboration with the World Health Organization as development partners.